Hello everyone. Assalamu alaikum wa rahmatullah. Today, inshallah, we will cover the introduction for part 3 MRCOG, and I added little, like, I'm gonna say like just one slide for how to fail. So why I choose this like slide specifically to start with? Because it's just some points which is like most of the candidates commonly do this, or already they did that in previous exams, and unfortunately they weren't able to pass the exam. So it's a very common mistake, it's highly repeated mistakes, and it's very easy to avoid once you will be able to understand these points here. So you will be able to pass part 3 MRCOG. So I love this picture. It's like a marathon. It's exactly the same while you are in your preparation for part 3 MRCOG. You are just before the end line and you need to pay more effort. If you watch any runner in any marathon, you will find them doing more effort before the end line. Why? Because they need to pass, they need to be the first. So it's exactly the same. And now, like 4 months or 4 months and a half before the exam, you are exactly same like this. You are before the end line. You are not still at the start of the marathon, or you are not at the start of this. So please pay more effort, do your best. I know that all of you, all of us guys, we have a lot of commitments. We have the family, we have the work, we have everything. But it's just 4 months. Please keep this exam your first priority. Keep the study your first priority. I know that you will find a lot of distractors around you. A lot of things will take you to this way, that way, but please concentrate. And by the end, you will celebrate with your family. You can um, do some like activities with them after the exam. But if you will say, for example, I have family, I don't want to ignore them, and I want to manage the family. For sure, you need to manage the family, for sure, especially the ladies, but keep the exam your first priority, right? And for sure, your family will be affected, but they will be very happy by the end when you will pass this exam, right? Again, the work, I have work, I'm not able to study. I have work, I'm not able to attend. No, please, yes, the work is there and it's very important, but the work will never end. It will be there all of the time. But the exam is just 4 months, and it's either congratulations, you passed, or unfortunately, you didn't reach the expected level. So it's your choice now. Do you want to go to this way or that way? This is the new slide in the introduction, how to fail in part 3. I put it here like as summary, but we will touch each point in detail, right? And just reverse this point, take it as an advice, and that's it. So how to fail? Number one, go without study partner. From my point of view, study partner is the cornerstone for this exam. It's even more important than any course. This is from my point of view. It happened with me. In my course, I had 2 candidates only passed without study partner, but 2 among from hundreds. So which one you will follow? Just like a solo experience for one person, or the group? No, from my point of view, study partner is very important, right? I will come to this point. Number 2, go without understanding all the recalls. You have to know all the recalls before going to the exam. Don't in the few months before the exam, like from now till the exam, don't read anything new. Any new talk article, ignore. Anything new, ignore, right? Don't think like this talk article might come in the exam. Don't think like this. Why? Because if I will have like one new scenario, one among 14, it's new, right? You need to cover a lot of things. For example, the talk article, like 4 or 5 topics to secure potential one new case. But you have still 13 you can manage from all the recalls you know. And the recalls now everywhere. It's now very, very easy to know. It wasn't like this in the past. So it's now very easy to know how about the cases. Just understand the topic, be familiar with the different scenarios in the exam, because now the RCOG, they are changing the scenarios, but little changes, little, not like massive change in the scenario. And I feel it's fair enough, because I want to know if you understand the topic or you are just memorizing this, right? Number 3, go without time management. And the time management, I will split it into the 2 and 10 minutes in the exam, which is related to the task, and time management now in your study. So the time management, it's general time management and specific time management for each case, the 10 minutes and 2 minutes. Go without understanding the domains. So we do have 5 domains. You have to be aware of the 5 domains, and which in each domain we will touch important points related to the safety. You need to cover this in the exam. Ignore the patient safety and you will not pass this exam. Patient safety, like what we are telling usually, for example, if you are in a structured discussion, you are telling the examiner, I will keep the patient safety my first priority. Yeah, you are telling, I don't want it to be only verbal. No, I want it to be like obvious in the exam to the examiner that you are keen about the patient safety. Ignore the patient agenda. Ignore the patient. Interrupt the patient. You will not pass this exam. It's very, very important. Usually in the exam or in some stations, the examiner will ask the role player if you are happy to see this candidate again or not, right? I attended in one of the exams here. It's not MRCOG, it's for the medical students, the people in the university, they are studying medicine. It's just last week. I was one of the examiners there. So I have a role player with me in the cubicle. And after the student, the student now finished and went outside the cubicle, she has to point to me from 1 to 5 with her fingers. It's not allowed for us to speak, just to say 1. So it means I don't want to see this student again. 2, like I prefer not to see. 3, indifferent. So it's like plus or minus. Yeah, I want to see, I don't want to see. It's like indifferent, right? And 4, more likely to see or prefer to see. And 5, it means this student was outstanding and she loves to see this student again. So she has just to point with fingers to me. So it's very, very important to take care of the patient. Don't look at the examiner. Just take care of your patient in front of you. Ignore patient safety. Ignore patient agenda. Don't attend regularly. And here for any course you are in, guys. So with any mentor you are attending, please attend regularly. Don't say, I will listen to the recording. No, you will not be able to recap. You will not be able to catch this or catch up and reach the point, the course in. Follow the schedule, attend regularly. If you want to listen again, it will be very, very good practice. But don't say, I will not, even if you are a listener, you will get benefit of attendance. Number 1, to be regular and to be adherent to the schedule. Number 2, maybe one of the questions will pop in your mind and you can ask the question in the session. So it's very, very important to attend. Advice number 8, go without having a frame or template for each module. Again, I'm insisting on having a frame because it will help you, and I will come to this point, guys, how to follow the frame, because it will help you to answer the new scenarios. In last May, we don't have like new scenario, recent one. We have some changes on the old recalls, but in November, we had a lot of new scenarios, if you remember. So I remember with my candidates, they weren't like shocked. Why? Because while we are preparing, I was telling them, take care of the new scenarios. So how to manage the new scenarios? Have the frame, the template. You will get marks from nothing. This is the secret, right? You will get marks from follow this template. I know that some will say the templates are not good, but no, the templates excellent, because number one, it will keep you not hesitating in the exam. It will keep you fluent in the exam. And I don't mean here to be fluent in English and to have the English accent. No, I mean that you will not stop to think, what is the next step? What is the next question? What should I do now? No, you will go fluently, and this also will save your time. And it will help you with the new scenarios. So 3 benefits or 4 benefits from following a frame for each module. So if we will take all of these mistakes and we will do the reverse, go with the study partner, understand all the recall, control your time. Time management is important. Understand all the domains. Take care of the patient safety. Take care of your patient. Follow the patient agenda. Don't interrupt the patient. Attend regularly. And go with a frame or follow a frame or template for each module. Right? I will add here advice number 9. What about one of the causes, the most common cause to fail? To deal with part 3 as part 1 and part 2. Right? So what we need to do? No, it's different. Please, for all of you guys, part 3 is totally different from part 1 and 2. You already assessed in the knowledge. Here, they want to see how you will apply this knowledge on a patient, and also how to keep the patient safety, how to communicate with the patient. Sometimes you will be like, even if you will start work here in UK, you might face difficulties in the communication with the colleagues, with the people around you. You might lose your job, they consider you, for example, sorry about that, but it's really very important, especially for the people who, like, they came here and started the work directly. They will consider you some sort of rude. They have a special way, like, in dealing with each other. So it's very, very important to know that part 3 is different. It's clinical, not just the knowledge. No, how to apply the knowledge, how to keep the patient safety, how to communicate with the patient, and involve other subspecialties with you. They want to see how you will apply this, right? So these are pieces of advice I have. Let's start to analyze. Number 1, study partner. As I told you guys, study partner is the cornerstone for this exam. As you can see, I put here like very, very nice pictures. As you can see, the study partner will put you on, like, back on the track, and you can follow a schedule together, right? The study partner, if you are distracted like this girl, the study partner will get you back, right? So study partner is very important. And because of the nature of this exam, as I told you, it's different from part 1 to part 2. So it's mainly clinical and it's mainly speaking. Like, do you know the IELTS or the OET exam? It's 4 parts. Part of them is the speaking. If you will go and you will do the speaking, it's you have one patient and you need to counsel, right? So it's mainly speaking. So what we need to do, just reading the guidelines, summarize, make your notes. It's all important. I will not say no. But what is the most important? Speak with someone. The sessions, important, yes. But in the session, you will present one case or 2 cases. But with your study partner, you will do at least 3 to 4 cases daily, on daily basis, not one station weekly. You got the difference? That's why if you will ask me, I will say study partner is most important. And if you will study partner or course, study partner. But to be with one thing, guys, to have full understanding of the recall. It's very important. You will not go and study with your study partner without having this knowledge, the recalls and the cases which might come in the exam. So that's why study partner is very important. It's a speaking exam. It's not knowledge. It's not written. So I need to speak with someone. Study partner will help you in that. And another point, which is very, very important, that with your study partner, you will do the case, your study partner will be the examiner. And then the study partner will do the case, and you will be the examiner. Like she or he, like your study partner will be one time the examiner, and you will be one time the examiner. So what is the importance of that? Usually, I'm giving this advice for all my candidates. If you will be able to pick the mistakes, you will pass this exam because you will see how it's like repeated, how these mistakes can affect the marks. And you are able now to pick the mistake. You got the point? So study partner is very, very important. Study partner is the cornerstone for this exam. Please don't go to the exam without study partner. Usually, I'm checking all my candidates. If you don't have a study partner, send me a message and I will try to arrange a study partner for you. Try to have the study partner from same city, same time zone. It will be like more convenient and it will be easy for both of you to meet together, right? Uh, maybe same language. So outside the study, you can communicate in your like mother tongue. It will be very easy for you guys. So study partner, my first advice, and as you can see, I put it my first advice, right? Before knowing the recalls, before the time management, before everything, right? So study partner, cornerstone. Advice number 2, work smart. So we have work smarter, work harder. No, we need to work smarter and little harder. I will not say work smart only, so you will not do any effort and you will go without studying. No, you need to pay effort. You need to do some work from your side, but work smart. And this is the rule of the template or the frame. If you will have a template, I will go introduction, information gathering, I examine the patient, explanation of the condition. If you have breaking bad news, do it, and then management plan. If you will go like this and put a time frame for each section, it will be very, very easy in the exam to pass. I will show you here 2 different people. So how to work smart. If you have a look on this guy and that guy, it's almost the same mass. But here, this guy used the mass in the form of a sphere and push it. It will be very easy. With little effort, it will be easy to run. But this guy kept his mass as a cube. So what do you think about the effort this guy will pay and this guy will pay? This is how to work smart. Change the study material to a form which will be for you easy to digest. And for you, you will pay less effort to understand and to manage all the cases. And this will be by the help of the template. This is now a template. We will reshape the materials we have. Okay, guys? And it's not necessary to have one template. Like, of course, usually I'm telling the people, take my template, use it. Make your own template. Take my template, make changes, and use it. So 3 things you can do. It's not like something all the people will go with it, but make your own template. So in the exam, you will go quickly, you will be fluent, you will not hesitate, and everything will be very easy with you. So work smart and little hard, right? I will not say work smarter, not harder. No, I will say work smarter and less or little harder. Advice number 3, time management. So as I told you at the start, we do have general time management and station time management. General time management, what I need from you, from all of you guys now, to study at least 3 to 4 hours daily. You can split this 2 hours with yourself. For example, you have a study partner and you put a schedule together. So let's do now early pregnancy. How many cases do we have? 9 cases in early pregnancy. All right, so we will do 5 cases today, 4 cases tomorrow. So we can finish this in 2 days. If we are at the start, and I can consider this now, you can finish the module in 1 week, right? When you will finish the module in 1 week, so you can finish 1 to 2 cases daily. And also, again, you have to be smart in general time management. For example, I have one day I'm on call, so I will not be able to study 1 or 2 cases. So I will not study anything today, but tomorrow I'm off. So I will finish 3 cases instead. You got the point? It will depend on your schedule at work and try to manage. Sometimes, even if you are on call, it will be like a calm on call or shift. So you can do something. Listen even to a recording. Listen to a recording. And this is a type of study. It's just with you, with listening, right? Using this sense, the hearing, right? So general time management, every day, split this time. Take 2 hours alone, prepare the cases, and take 2 hours, do it with your study partner. So 2 hours study, 2 hours do with your study partner. Every day? Yes, please, every day. Every day. This is a cornerstone to stay and speak with your study partner. Time management for the station. Please, guys, it's only 10 minutes. I know that it's unfair because here in UK, we have 20 to 30 minutes to stay with a patient, right? So while we are in work, we have this time. Maybe sometimes, by the way, I can stay more than that. In the clinic, it's 30 minutes for each case, right? But sometimes if we have any emergency case, we can stay more than that. And no one will say why you are like consuming time with this patient. Still, I'm not done with everything with this patient. So I can take more than that. So it's unfair. But in the exam, they put this 10 minutes to put you under stress. They want to see if you will be able to work under stress or not. I need to finish in the 10 minutes everything. I will gather the information, I will examine, I will explain, and then I will highlight the management plan for the patient. And with all of this, I will keep the patient safety my first priority. How you will do this in the exam? You have to do it from now. It's from practice. Okay, guys? So you will not be able to finish in 10 minutes without studying every day, without practicing with your study partner, right? 10 minutes, 4 minutes, information gathering. Please try don't to take more than the 4 minutes by any means, not more than the 4 minutes. Explanation in 1 minute and examination, or 1 minute and a half. And then it will be around 4 minutes and a half, 5 minutes to tell the patient or the role player about the management plan, which will be more than enough. If you will be able to do that, it will be very easy for you to pass the exam. By the way, I faced like, I will not say many candidates, but it's not like around maybe three candidates. And these 3 candidates over years, not in one group or one batch. And they were excellent, really. Very great knowledge. They know everything. They even better than me. But the problem was the time management. And they weren't able to pass the exam. So you know the knowledge, you have the knowledge, but you don't have time to tell. So time management is very important. How to do it in the exam? You will not be able to do it in the exam without practicing from now. Practice the 10 minutes from now. The 2 minutes reading time, still I'm giving them the name of reading time, not preparation time. Why? Why not preparation? We can prepare outside the cubicle? No. My advice for all my candidates that the 2 minutes you have from the first line to know the case. You read the first line. Oh, this is the ectopic. You read this. Oh, this is pregnancy of unknown location, and so on. So it's not preparation time. It's reading time, still reading time. I can say you can formulate your answer while you are outside. How to do that? My advice, guys, you will have the notes in your hand and pen. Put the name of the patient here on the top, because usually you will forget the name. And if you will tell wrong name, your safety and communication will be affected. So take care of this point. In the history, put the important point, which is like you have not to miss it. Put it here. And if you have any points here, safety points, put it like that, or bullets, or formulate the management plan. So in your paper, put the important things that it's very important to tell inside. That's why it's reading time, not preparation. Already we are done with the preparation. It's just to read, reach the case, and put the important points in your notes. And that's it. It's just 2 minutes, right? So time management, general, station, and the station 2 minutes, 10 minutes, right? So what to do in the 2 minutes, guys? From the first line, you will know the case. This is the aim of the preparation, what we are already doing. So you know the case. What is the important points here in this case? In your mind, you know 1, 2, 3, 4. For example, it's ectopic. The sac more than 35. So medical will not be suitable. Put it here. So inside you will not be distracted if the patient insists to have the medical. Put, for example, if she's candidate for the medical management. Put the important points with the methotrexate, right? Like liver function, kidney function, sleep over in the hospital, follow up with the HCG, day 4, day 7, then weekly, side effects of the methotrexate, and the failure rate. You have to tell all of this. You can also advise the patient to avoid alcohol and smoking while she's taking methotrexate. Usually one dose will not give that much side effects. Usually it's more if it's given like as chemotherapy, right? So outside, just to put, you can even practice this from now by putting like letters, like for example, methotrexate. So avoid pregnancy 3 months, put it like this, or pregnancy, right? HCG, failure. You can put just letters to remind yourself inside the cubicle. So you will not, all of these points, by the way, safety points. To avoid the pregnancy for 3 months, sleep over in the hospital, HCG monitoring, failure, need of second injection, 15%, surgery, 7%. Is it important to tell the numbers? I'm very bad in numbers. No problem. Don't tell numbers. But tell the patient that there is like a risk of failure. And at that time, we might need to have second injection or a surgery. Like that. So it's a way how to take the benefits of the 2 minutes outside. So time management, my second advice. Oh, sorry, I think we have questions. Just 1 second. Sorry, guys, because it's not on the screen. All right. So good. We have 2 candidates here now. They are trying to communicate with each other for study together, to be a study partners. Very well done. All right. Coming to the exam format. And from the exam format, we will come to the domains and advice regarding the domains. So 14 stations, 2 minutes reading time, 2 minutes and a half for the online exam, which is still ongoing for some places, but it's not all for reading time. So it's not the 2 minutes and a half reading time, 2 minutes reading time and 30 seconds to move between the stations from one task to another, and then 10 minutes to finish your task. We have 5 simulated patient tasks, 5 structured discussion, 4 simulated patient tasks with lay examiner. Another common mistake. It's usually done in the online while we are in the course, like not to know if it's a structured discussion, to forget, right? And this can happen, guys. And also it can happen in the exam. The simplest way to know, is it one person inside the cubicle? Just one? It's a structured discussion. This is the examiner and it's a structured discussion. 2 simulated patient task. One will be the examiner, one will be the role player. 3 people inside, so examiner, role player, and lay examiner. All right? So this is a way how to know which station you have. It happened in November, again, last November, that especially in Egypt, in the center, in Egypt, there were more than the 5 structured discussions. So I believe it's the problem with the role players, right? So it's not a rule. Maybe someone attended in November and they gonna say, no, it's more than 5. So it happened only in November. And I believe it's because of lack of the role players. We don't have enough role players, right? So usually 5 and 4. So this is the exam format. Modules, 14 modules. We have overlapping between management of labor and delivery, antenatal and maternal medicine, surgery and post-operative. So usually you will find those modules, we will do it together. It will not be separate, right? Management of labor and delivery can be covered in one session, but we need to cover the labor ward characterization. So it would take another session, for example. But antenatal maternal medicine, 2 sessions, and even it's not enough because in antenatal maternal, we have now around 30 scenarios, 30 in the exam, or recalls, right? Surgery and post-operative can be covered in 2 sessions. They are 14 tasks, all right? So these are the modules. For the domains, 2 marks each. So information gathering, communication with the patient and relatives, patient safety, communication with the colleagues, and applied clinical knowledge. Why I put that each domain 2 marks each? Because some of the candidates will pay here. Do you remember the time management? 7 minutes. And 3 minutes will be for the management plan, including the safety, including communication, including everything. So it will not be enough. And they will lose all other domains. Please remember that all the questions you asked, it's only 2 marks by the end. Either 2, which is pass, 1, borderline, or unfortunately 0, which is fail. Right? So pass, borderline, fail in each domain. So it does make sense now that we need to manage our time, not to pay more effort and more time in the information gathering. Okay, guys, take care of this point. In any station, go with the frame, with the template, introduction, agenda, information gathering, examination, explanation of the condition, set the appropriate plan and ending. And my advice, because usually, or not usually, it will be difficult at the start, but by the end, it will be easy to finish in the 10 minutes. But in the exam, you might face 2 or 3 scenarios, very long, with some role player questions. You will not be able to finish in the 10 minutes. So you will lose the end, which including the patient information leaflet, which is, I consider this patient safety, if you will not give. It's very important. So my advice to give it here with the agenda by saying, by the end of our consultation, I will provide you with some patient information leaflet or with some written information to know more about your condition. How does it sound to you, or is it okay? Ask any question like to check if the patient, she's happy or not. Okay, guys, I will go back to the previous slide to touch one point. Actually, it's not one point, it's many points regarding the patient safety. Patient safety, it's the tricky domain. Usually, this is my advice to all my candidates. If you want to pass this exam, please try to pass the patient safety. Why? It's tricky, as I told you, you need to pass it. And the second cause is it's related to all other domains. You will find points in the information gathering related to the safety, like blood group, if the patient pregnant or going to surgery, she can accept blood transfusion or not. Again, going to surgery or pregnant. Allergy. Safety of all modules. If you will not ask about the allergy, your safety marks will be compromised. And unfortunately, 1 point missed, borderline. 2 points missed in the safety will give you fail. Even if I covered everything, yes, unfortunately, yes. So take care of this point. If you will miss 1 point of the safety, it's borderline. If you will miss 2 points, it will be fail. Communication with the patient and relatives, to be nice, check understanding every now and then, give the patient information leaflet, which I consider this safety, right? You will find even in some books, some of the examiners consider this safety. It's not necessary to be in all cases in the exam, because if I'm an examiner and I will put this question, I have to put my view about that. I would say here I need 5 safety points to be covered, and I will put patient information leaflet one of them. Another case, another examiner will say, no, I don't want this information leaflet to be part of the safety, but keep it in your mind, it's part of the safety. So if it's there, you will not miss it. That's why my advice to give it at the start, guys. I'm not sure if I'm clear or not. If you want me to repeat anything here, because now we are speaking about very, very important points from exam point of view, right? So if you have any question, just you can drop a message here in the chat box. So communication with the colleagues. If you have MDT in the case, so it's a safety point. Okay, guys? So multidisciplinary team, if it's there, it's a safety. Applied clinical knowledge, it will depend on the scenario. As I give you the example of the methotrexate. So with each case, you will have some safety points in the knowledge. Sometimes it will be 1 or 2 points, and sometimes it will be like a lot of safety points, right? So it will depend on the scenario. So patient safety, please take care of this tricky domain. Another advice, if you can do it from the start now, with each module, make flashcards. You know the flashcards, you can buy it from any, the bookshop and this stuff. So you can, in any bookshop, you will find cards. It's not paper, it's like a cartoon thing. And sometimes it will be like this, or sometimes also it will be with lines. So you can take the flashcard and put here the topic. For example, ectopic pregnancy, and put all the safety points from the start. I love this flashcard because it will be as last minute revision for you, right? I remember in my part 2 preparation, I made this for part 2. Each card for one case. And I put the input. At the time, it wasn't like the safety. It was the important point, which I need to know about this case for part 2 exam. So now my advice, do it again for part 3. But for the safety, to be easy for you to do, and it will give you like last minute revision. It will be very, very good thing. When you revise like 2 days before the exam, you have, for example, 200 cards. Quickly, you can go through it in one day, right? So these are the domains, and the most important domain, the patient safety. This is the template. Let's go with the template in details. As I told you guys, it's not important or it's not necessary to take mine. No, you can make your own template. You have different introduction you are using in work, especially the people, they are working here in UK. It's not like necessary to use the same one. So you can use your own way, right? Or take this, make some changes and use it, or take it as it is. So introduction. Hello, I'm Dr. Rana, one of the doctors here today. I'm one of the doctors in charge today. I'm one of the doctors in the clinic today. I'm one of the doctors in the ward today, right? I'm one of the doctors in charge today or on today. Can I confirm your name and age, please? And then, how would you like me to call you? To be honest, guys, here we are using date of birth, right? But for the exam, it's just the age. You can use the age, right? So how would you like me to call you? How can I call you? How can I address you? Is it okay to call you Julie? This is what I mean. So you can take any of these questions. Which question you feel it's like easy for you to use? Which question you are familiar with? Take it and use it, right? So how would you like me to call you? I love this, actually. I feel it's like the most polite one. How would you like me to call you? How can I call you? How can I address you? Or is it okay to call you Julie? And then go. Setting the agenda. Why setting the agenda is very important? Sometimes you will find hidden agenda, and now it's more common in the exam, so take care of that. The patient here with bleeding, but she wants termination. The patient here, she wants the termination, but when you will start to speak with her, you will find hidden agenda, like she had this X-ray. I'm speaking about early pregnancy more now because it's like my first module usually. So we have this hidden agenda, like she had the X-ray, she had another problem, right? And it's hidden. But when you will explain everything to her, so she can accept the pregnancy, and she will, if you will give her the two options, terminate or to continue, she will go with the to continue the pregnancy. You got my point? Hidden agenda also now, the drug use, the cocaine users or any drugs, smoking, alcohol. It's not hidden. Usually the drugs or alcohol are the hidden agenda. And now it's very common in exam. And to be honest, guys, it's very common in practice here. And you will find the lady, she's a smoker and pregnant. She will find her like using drugs and she's pregnant. Usually they will face a lot of complications. So they are in practice. We are facing them on daily basis. So that's why now the RCOG, they are making more pressure on these points to have, don't say, oh, she's pregnant, poor lady, for sure she's not a smoker. No, ask her, right? So the agenda is very important. Number one, to set the agenda with the patient, to discover if we have any hidden agenda, or if the main cause of the visit is not in the notes. And the patient will tell you, I'm here today to terminate this pregnancy, for example, right? So it's very, very important. So I've gone through your notes. Is it necessary to use this? No. I have here your notes. I read your notes. I see your notes. I know that you are here. So use whatever you want, guys, but make it like the same way with all stations. It will give you like, now your job will be easy, not to think what to say, right? So I've gone through your notes. I understand that you are here today because you want to know the results of your blood test and scan. Is that correct? Or I have your notes here. Or I know from the midwife or from the nurse that you are here today to discuss this point. Okay, guys? So I have your notes, I see your notes, I read your notes, I understand, I've gone through your notes, whatever you want to use. Ask the patient, do you have any other concerns or expectations from this consultation today? Nothing? All right. I will address all your concerns, or if she mentioned anything, within few minutes. But before that, I'd like to ask you a few questions to know more about you. Can we use different way? Yes, because it's the first time to see you, I'd like to ask you a few questions to know more about you. Is that okay? Yes. By the end of our consultation, I will give you some written information, patient information leaflet, right? To know more about your condition. How does it sound to you? Yeah, it sounds good. So this is how to set the agenda. Coming to the information gathering. Here is the template. I know that some of the mentors or people will be against the template, but it's very important in the exam. It's not to memorize it by heart. Make your own and use it. It will make your life easy, right? So we need to concentrate more about how to communicate with the patient, how to secure all the safety points, not to think in the exam how to ask the questions. So it's very important to have this in your hand while you are preparing for the exam. Information gathering. Please, two advices or two pieces of advice here. Number one, start with open question. Number two, start with history of the present illness. The patient here with bleeding, right? Don't ask her, do you have any medical problem of concern? As first question. No. Start with her complaint. Start with her problem. I understand that you are here because you have some PV bleeding. Is that correct? I'm really sorry about that. Would you please tell me more about this bleeding, when this happened? How about the amount? And then the patient will start to give you, like, for example, tell me more about this bleeding. So this is open question. By the way, they love in the exam, they love the open questions. because it's better than the closed one. What is the difference? The closed is how many pads did you change in day or yesterday, for example, right? This is closed. I need number of pads, right? But would you please tell me more about this bleeding? This is open question. The patient gonna say, oh yeah, doctor, so this bleeding actually, it started for 7 days now. It was okay at the start. It was just a spotting, but in the last 2 days, it's literally, it's like flooding. I'm changing around like 7 to 8 pads per day. And even like there is like soaking of the pads on my clothes as well. There is no clots passed, but it's heavy bleeding. And also I have some pain here in my lower tummy. So how many questions? She answered. She said, since when it started, 7 days, it was at start spotting and then flooding. So it's increasing. Second question. No clots. Third question. Changing 7 to 8 pads. Question number 4. And there is pain. Question number 5. So imagine if you will start with closed question, you need to ask her 5 questions. You will consume your time. If the patient said that, don't ask her, don't repeat that question again, but you can recap by the end. So you mentioned that we are using this in practice, but in the exam, it's not. I will not give you this advice because you will consume your time. So in practice, we're saying, just to recap, so you have this bleeding for 7 days now, it's more in the last 2 days, and you have this, and that, and no pain. Then start to add more questions if it's not covered in the open question. For example, have you tried any over-the-counter medications? Did you seek any medical advice, like to visit your GP? Any attacks of bleeding before that, or it was the first time? So we can add here more questions about history of the present illness, which is bleeding. We have patient with bleeding. What are the important points to cover as well? Cover the red flag signs to rule out the malignancy. Do you have any loss of weight, loss of appetite, any urinary problems, any bowel problems? Here we have, she answered the bleeding, the pain. Ask about the lump as well. Do you have any lump down below, or do you feel like your tummy is a bit distended or bigger than normal? So here we are covering everything related to the bleeding. Then move next. History of the present illness will take most of the time, like around 1 minute or 1 minute and a half to know her complaint. And then continue with your information gathering. Usually, in any case, I have the 3 slides in same sequence. In some stations, if we have emergency, you will find just 2 slides. Why I'm keeping this constant? This is the smart way of study. So this is how to study in a smart way. So you will not, this question. What is the next question? You can ask, this patient has bleeding. So ask her about her last period. It might be heavy period or it might be intermenstrual bleeding. So menstrual history here will be important. I kept it here because this is the template. But for example, if we are in the heavy menstrual bleeding, it will be with history of the present illness, right? When was the last period, regularity, any pain with it? Have you ever been pregnant before? How many children do you have? And how about the mode of delivery? When was the last one? Oh, right, that's good. So how about your recovery? Was it good? Perfect. Do you have any discharge from down below? No, doctor. So some personal questions, sorry about that, but it's very important to know more about you. Do you smoke? No. Do you drink alcohol? No. Pardon me, do you use any recreational drugs? No. Sometimes what I'm saying here in practice, because it will be like, you will be embarrassed, like to ask about drugs. So I'm saying, I'm really sorry, I have here some boxes, I need to tick the box. So do you use any drugs for fun? No. Usually we are asking about the weight. You can ask about weight to height ratio or the weight of the patient. Safety points on the right corner. Blood group, as I mentioned, patient pregnant, patient going to surgery. It's like examples. In some stations, it will be important, like heavy menstrual bleeding. Because sometimes you might need blood transfusion. In heavy bleeding, yes. We face this many times, and I'm pretty sure that you face this in your practice. You might face a patient with heavy period and her hemoglobin is 65, 69, and she will need blood transfusion, at least 2 units at the start. So you need to cover blood group and transfusion concern. Do you have any drug allergy? No. How about your cervical screening? Is it up to date and normal? Yes. In the work, by the way, we have a forma, like if you will see the patient for first time, you need to fill it. And all of this will be questions, like cervical screening, when was the last time? Normal, abnormal, LMP, and you will find like exactly the date, like to pick from the calendar. It's like points, so you will not forget anything. But in the exam, we don't have this format, so you need to remember all of the points. Then continue with your template. What is the next step? Medical. Do you have any medical problem of concern? No. Do you use any regular medications? No. Do you have any surgeries done in your tummy or down below before? Any family history of concern? In the last 4 weeks, did you feel that you are depressed, low, not interested to do your usual activities? And how about support at home? What do you do for a living? Rule out domestic violence in some cases. So take care of that. Domestic violence, it's very important now, 25% in UK. So please don't ignore domestic violence in some cases. Like what? I'll give you also a clue for this. Patient, for example, she said having like falling on stairs and she's pregnant. Check if anyone like pushed her or anything, like she was she has this domestic violence, her partner or anyone at home, one of the family members, right? Patient with multiple visits, frequent visits to the emergency with reduced fetal movement. Any patient with multiple bruises over body, right? So bruises, frequent visits, reduced fetal movement. Patient like with falling, history of fall like on stairs. So all of these, you need to rule out domestic violence. So we are done with the history. Just say, thank you for sharing this information with me. Do you want to add anything? What is the importance of this line? Two things, guys. Two things. One for you, or actually both for you. Not one for you, one for the patient. Both for you. Number one, to show respect and appreciation that this patient shared her own information and personal information with you. The second benefit, to get your like this, deep breath and relax. We are done with the information gathering. And it's like, I will move to the next step, right? One of the points, as I mentioned, when I was in this exam for the medical students, that if the medical student gives signpost between sections, so now we will move to this point. Now we will move to the examination. So if you are giving signpost, it's a good practice. You are a good doctor, right? So moving to, just 1 second to check if we have any. All right, no, not questions. Okay. So I will put here, I can see that you are searching. Just 1 second, guys. I will put by the end the link of the group, so you can communicate on the group if you are not able to reach each other, right? So I will put for you and Hinat. So I will put the link so you can communicate on the group, just to reach each other and then communicate on a private message. Examination. I'd like to offer you examination in presence of chaperone after your permission. Is it okay? Yeah. I need to check your tummy. I need to check you from down below. We might need to take swabs. So explain what and why do you want to do this examination? And then just say thank you for sharing this. Thank you, sorry, for your time. Coming now to your concern. This is a signpost. So you are just saying thank you for your time about the examination, and then moving forward. Now coming to your concern. If we have breaking bad news, please give first signpost, second signpost. I can see that you are here today alone. Do you want someone to be with you? And then, I'm really sorry. I'm so sorry. I think I don't have a good news for you. I'm really sorry to be the bearer of this news. And then tell the bad news directly. Your scan showing that you have a cancer. I'm really sorry about that. And then start to explain. Don't move around that.
diagnosis. No, give the bad news and then explain. For example, here I put, but it's not here a bad news. It's just concerning news, mastitis. So how to explain mastitis? Start from the early beginning. So poor milk drainage due to your baby not being well attached to the breast or has some difficulty in feeding. Sometimes with the tongue tie, the baby will not be able to breastfeed. So at that time, the mother might face this mastitis. So it's not necessary to be just the attachment. No, sometimes difficulty in feeding. Some parts of the breast might not drain well during feed, causing the milk to accumulate or to build up, stop flowing, and the blockage will happen. When the blockage will happen, the milk will start to leak inside or outside the duct, and it will be in the breast tissue. And the body will deal with it as foreign body at that time. It will start to attack this area. So that's why you will start to feel this pain and redness, hotness. Your body might, or you might have this bony aches as well as a reaction, and high temperature. Sometimes the bugs will come on top of the milk and causing infective mastitis. And then if the pus will be formed, it will be the breast abscess. I'm really sorry about that. So this is how to explain. And by the way, mastitis came not in last May, but came recently in the exam. So it's important scenario, right? Even something very, very simple. And all of us, we know how to manage mastitis, isn't it? So how it's like a common station in the exam. Because it's not only how to manage mastitis. As I told you, it's not just the knowledge, how to communicate with the mother, how to ask the questions, how to show empathy, especially if she's primary, or now she's para one, first baby, she's not able to breastfeed the baby. Sometimes we might need to keep the patient in, keep her admitted, just because she's not able to breastfeed the baby. So it's not like something to take it like easy or lightly. No, we have to like pay more effort regarding the breastfeeding, for example, after delivery, especially in the para one and first baby. So that's why it's common station in the exam, right? If you will think it's very easy, why to have this very, very easy station in the exam? You got my point? So this is how to explain. Sometimes in the antenatal or maternal medicine, the mother will know, or she knows already about her condition. She's diabetic for years. She's hypertensive. She has thyroid. So here, you will not explain diabetes in type 1 diabetic mother. She knows everything, even more than you, about diabetes. But she wants now to know the effects of this disease on her and on baby, and effects of the pregnancy on the disease. So this is here explanation of the condition in antenatal or maternal medicine. Sometimes in antenatal, you need to explain because it's a new thing for the mother. It's not like maternal medicine, like patient with ultrasound showing talipes, Down syndrome screening, showing high risk to have Down syndrome baby. So you need to explain what is the screening, what is Down syndrome, and how about the next step. You got the point? So explanation of the condition, we can do it as like mastitis or any new condition you need to explain. But if the mother has maternal medicine, has a condition, she knows about it, so you need to speak about the effects of the disease on the pregnancy, effects of the pregnancy on the disease. And then finish your task after the management plan by giving information leaflet. And now we have the advice. We will give it at the start, just to secure the information leaflet, that you give the patient information leaflet. Is it right to give it at the start? Yes, sometimes even in practice, at the start, we can say, by the end, I will give you some leaflets. I will double check if we have some leaflets regarding this. Sometimes even if we don't have the leaflet like copy, we can give the patient like the address online, like just to type it and to go and read, right? So we can do any of this, but it's very important. Now, this point, it's related to the course, how to reach the materials. So I will jump this point and I will come to how to read the patient information leaflet. Patient information leaflet. So my advice, any patient or any scenario, simulated patient task, you need first to be aware about the information leaflet because it will give you the way of counseling, layman language. So if you are old-fashioned, you can print this out and study in paper, right? By the way, I did this in part two, so I'm not like saying any of you will be old-fashioned. I did this in part two. I printed all the guidelines because at that time, I don't love to study on iPad or a device. But with time, it's very, very difficult to move with paper. So in part three, I was like studying like this. So on your iPad or tablet or anything, you can download the PDF and then just highlight the heading and then what is the condition. For example, here I picked the molar pregnancy. So what is the molar pregnancy? It named gestational trophoblastic disease. Rare condition happen when the pregnancy does not develop normally from the very early beginning. So it's a way how to counsel the patient. So you can use this line exactly the same in counseling of the patient. And then the patient information leaflet will give you key points by the end. So it's very important to highlight the important points as well. If you will have a look here, what is GTD? What is the molar pregnancy? What about the types? We have complete and partial. Even here in the information leaflet, you can explain to the patient what is complete and how this can happen, what is partial and how this can happen. And with this highlight, when you will go back and revise, just go with the highlighted parts. So it will be, again, another way of revision. This is partial mole. And what might a molar pregnancy be suspected, or when to be suspected? If you have like irregular, heavy bleeding, sometimes molar pregnancy will come with the hyperemesis, if you remember. So it's very important to rule out the GTDN, hyperemesis gravidarum, very important, right? Why I'm telling you how to study the information leaflet? For two reasons. Number one, some of you will go just with the guidelines, which is not correct, which is not suitable for part three. We need to know how to counsel the patient, right? So we need to know the layman language. It will come with the practice. It will come with reading patient information leaflet. Sometimes I'm going to say, go and just touch the guideline, not to read the guideline. Check the point here of management. Even in the information leaflet, you'll find the management, right? So sometimes even just touch the management in the guideline and that's it. Quickly, one time, don't go back again. But information leaflet, you can read it once or twice. This is the first reason. The second reason, guys, because I know that now that most of the courses will provide you with the materials beforehand. For me, even, I'm giving all the materials beforehand. So before starting, so all the people will have all the materials. So sometimes what will happen, you will go and read the PDF only, which is wrong. The PDF will be the last step. So now why I'm explaining how to read the information leaflet, because I need from all of you to study like this. And then I'm done with the 7 cases. We will discuss it like, for example, next week in the session. I'm done with the study like this, in that way. I will go to revise the PDF. I'm providing, for example, PDF and recording. So my advice, number one, patient information leaflet and touch the guideline. If we have a structured discussion, it will be guideline to study the guideline because it's a structured discussion with the examiner. So shall we know which is structured discussion? Yes, you have to know this case, simulated patient task, this case, structured discussion. After you are done with the 7 cases, right? 7 cases, we usually with any mentor, with any course, it will be 7 to 8 stations in a session. So if you are done, go and read the PDF. Revise the model answer. So for example, I'm providing the PDF with the model answer, go and revise. I'm giving another advice. If you can listen to the recording I'm providing, it will be excellent. You will listen to the model answer of the 7 cases and revise the PDF. Then we will come to our session and apply. You will be excellent. It will be like a revision. After session, again, revise the PDF. You are done with this module till the exam. Just like 1 month before the exam to revise. You will not need to go back again to cover anything in this module till the last revision before the exam. But you have to do it like this. Patient information leaflet, touch the guideline. Or if it's a structured discussion, it will be the guideline. Then either to just revise the PDF with the model answer or listen to the recording, revise the PDF, come to the session. The session usually around 4 hours. So it will be like a discussion. You have questions. For example, while you are studying, you have a question. Why? In the PDF, it's written like this. Why? I told the people like that. Ask these questions. And then after session, go and revise the PDF. You are done. No need to do anything in this module till the last revision before the exam. Okay, guys? So it's advice not only for my candidates, not only for my course, it's for any course you will attend. Okay, guys, here we are speaking about all of you. If you are attending with any mentor, please follow this advice, right? What about the follow-up will I have? So I'm here putting like these slides to show you that the patient information leaflet covering everything till the follow-up, even till the GTN and how to manage it. It's very, very important. When can I get pregnant again? Any long-term problems or sequelae or complications? What contraception can I use? All of this can be exam questions, especially if the information leaflet published by the RCOG take care of the questions like this. Okay, guys, that's why I picked this patient information leaflet. It's a recent one in 2020, and also not just recent, it's published by the RCOG. So, you know, all these questions might be, not might, like I'm going to say 90% will be exam questions. If you will not cover, the role player will ask you those questions. Okay, guys? So this is another way of how to study smart. Do you remember in the time management when I said 3 to 4 hours study, keep it 2 hours by yourself and 2 hours with the study partner? Those 2 hours you will do this and highlight. When you will highlight and you will come back, so you will go with the highlighted parts only. You will not read the whole paragraph, right? So this is how you will prepare yourself. Okay, guys, this is all for today. This is my advice for all of you. If you will follow this advice, inshallah, you will have like a high chance to pass the exam, right? If you have any questions, you can drop a message now or even on the group. I'm not able to share like the links and other things on some of the groups. So you can just join the channel or the study group. So if you have any questions, you can drop a message. For our next session, inshallah, it will be the recent scenario. I posted a scenario on the group for volunteers, but I feel it's difficult. And I know it's difficult and tricky. The bowel injury after cesarean section. So I will arrange our next session will be to cover this, and then we will continue to have 2 or 3 sessions for labor ward. We are done with one session, so we will continue this, right? Any questions? All right. Thank you so much. Have a good day. Assalamu alaikum wa rahmatullah.